Hi everyone, today I'm talking about the SI joint. I'll show you where it is, how it can cause you pain, and by the end of this video, you'll have a technique you can use to fix SI joint pain yourself. Please hit the red subscribe button below so you don't miss my content, and check out the links in the description for more of my videos on low back pain. Okay, so first I want to go over what an SI joint is, where it is, and then how it goes out. So here is your pelvis. It is made up of two innominate bones on the outside, which are actually made up of three different bones, a right and a left, and then you've got the sacrum in the back, the little triangle bone in the back, and then where they connect in the middle, you have two, a right and a left. These are the sacroiliac joints, or SI joints for short. Now the innominate bones can get rotated forward or back. They can get rotated in or out. And then the sacrum in the back can get rotated kind of at an axis, forward or back, and stuck. And that causes pain. You've got muscles and ligaments and tendons that attach all around there. And so if something is off, even if it's by just a little bit, that can start to cause some problems with all of those tissues around there. The pain with an SI joint dysfunction is usually on one side of the low back. This is why it's confused with, lumbar pain, because it's in that region, but it's typically just on one side. The pain with this can sometimes radiate down into the glutes on one side. Sometimes it actually does wrap around to the front of your hip and the front of your pelvis. That can indicate you have an SI dysfunction as well. So as therapists, we have special tests that we do to try and figure out which way your pelvis is off and how that SI dysfunction is occurring, why it's occurring. But you don't really need to worry about that. If you just try this simple technique, it's called a muscle energy technique. So we're using all the muscles all around the SI joints to try and kind of rock that pelvis and get it back into place. That usually will do the trick. For my patients and for myself, this is what I've found helpful. And then to progress that on top of doing the technique, so you really only want to do the technique when you definitely feel like it's off, it's out. You've got one-sided pain, you've got pain coming around the hip, you've got pain into the glute, pain in the front of your pelvis. Try this technique. You may get a pop, like I'll describe after I show you the technique. And then you want to work on strengthening. So start with just gentle core strengthening, symmetrical core strengthening. So you want to start with pelvic tilts, bridges. I usually give patients press-ups as well, just in case there is a component going into the lumbar spine. That will kind of take care of that. And then you want to progress to the advanced core strengthening routine. So here's a technique for SI joint rocking. I like to use my foam roll, but you don't have to. So I'll show you both techniques. And again, you're not going to know what direction your pelvis is off. So we're just going to rock the innominate bones back and forth, and then we're going to reset with a squeeze at the end. So all of these, 3-second hold, 3 times through, and then you should be good to go. So we're going to push up, and I'm going to push this foot down into the mat. 1, 2, 3, switch. 1, 2, 3, switch. 1, 2, 3. 1, 2, 3. 1, 2, 3, and 1, 2, 3. And the reason I like my foam roll is because you want to end with a squeeze. So I like to do the squeeze with the foam roll. So what I do is hold my foam roll and push, and then I just do my squeeze after. If you don't have your foam roll, again, you just do push, 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 and then you can do fists together and then just squeeze your knees that way, or you can fold up a pillow, or if you have a small ball, something about that big, and then squeeze. And now sometimes you may get a pop, sometimes in the back by the SI joints, a lot of times in the front of the pelvis, and that just means it resets. So that's actually a good thing. Sometimes people even get more than one pop. Again, it's not a bad thing at all. Next week, I'm going to discuss some things to avoid if you have had or still have an SI joint dysfunction or SI joint pain. So stay tuned for that. Please give me a thumbs up and comment if anything in this video is particularly helpful. Share with anyone you know that has one-sided low back pain. They will be super happy that you helped them get rid of it. So thanks for watching.